It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
All right, we're back with the next guest, Dr. Tamara Dickson, naturopathic doctor, talking about autoimmune disease. What is that?
Autoimmune diseases are when your own immune system basically starts attacking your body, and there's a lot of those type of diseases out there, but you can treat them by changing the immune system and the responsive immune system.
All right, let's hear from Tamara Dickson.
Tamara, welcome to Health Talk. How are you today?
I'm doing great.
Well, thanks for joining us. We're going to talk about the immune system and autoimmune diseases, but before we do, I always like to ask our guest, kind of tell us about your practice and your interest in naturopathic medicine, kind of your training, your background, and maybe a little bit about your practice, which is Clarity Natural Medicine.
Clarity Natural Medicine, yes. Our office is in the Fremont-Ballard area. And I first became a naturopathic doctor out of the interest of finding the cause behind diseases. I was originally on a pre-medical track to be a psychiatrist, which I'm very glad I did not do. But now that I am aware of each individual having their own genesis behind the disease that they're suffering from, through the study of psychiatry, I realized that when you take medications away, symptoms very often come back, and I became more interested in understanding what we can do with the individual to change the reason that the disease happened or do a little bit more than just manage symptoms, and naturopathic medicine is an excellent way to do that.
You know, maybe before we get started into the kind of the conversation, I think it's always a good idea. Maybe you could talk about what your definition of holistic medicine is out there, or naturopathic medicine, because we have this traditional format of medicine and we have this natural or holistic format, and they're kind of merging in today's world. I mean, there's a lot of people seeking both options.
Right. It's a really good question, and the truth is that I think the answer comes from who you ask. But holistic medicine really, I think, is intended to mean that you're treating all aspects of a person's life and not just the symptoms. So whether or not someone is sleeping, whether or not they have a stressful job, if they're in good relationships and have family support, what they eat, if they exercise, you literally analyze a person's entire constellation of influences that could be behind the disease that they're suffering from, instead of focusing solely on symptom management. Sometimes holistic also means that you include alternative therapies, and that is, I think, where the definition differs amongst practitioners, is whether we're talking about holistic way of looking at the patient or a holistic treatment in terms of offering varied options.
And as a naturopathic physician, I mean, you're going to look at alternatives using, natural remedies. Things that are in nature, whether it's herbs or education, teaching, counseling. We're getting back to the body, really, the body, mind, and spirit, if I can kind of paraphrase there.
Correct. And in the state of Washington, naturopaths are trained as primary care practitioners, so we do have the right to prescribe when necessary, and I will certainly do that when I feel that it's necessary for that individual patient's needs. But our goal is always to support the body using natural treatments, using nutrients, botanicals, homeopathy, hydrotherapy, physical medicine, things that assist the body through its own healing process and are a little bit less about pushing the body in a particular direction.
Good stuff. You just mentioned a word that I think we should talk about as our listeners understand it. You said homeopathy. Maybe you can tell our listeners what that means and that definition.
Homeopathy is important to distinguish from the practice of naturopathy because they're not the same. So very often people will think that naturopathic doctors are homeopaths, and really it's just a subset of what we do. Naturopaths offer a variety of treatments, and homeopathy just happens to be one of them. So those are extremely low-dose medications. They're intended to nudge the body gently into a particular direction. It's almost always only directed at symptomatic relief and is never really considered to be curative.
See, that's what's great about this show. I just learned something. I've learned something every time I come on this show. Tell us about your interest in your practice, your area of specialty, if you will.
Over the years, I've started to specialize mostly in adult chronic diseases. As a primary care doctor, I started off doing everything. I used to see pediatrics and elder populations, and over the years, I started focusing on complicated cases. I like solving mysteries for patients. I like analyzing symptoms.
More with Tamara Dickson right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
Back with our conversation with Tamara Dickson and Shannon O'Kelly.
Tamara, once again, I want to thank you for coming on, and I want to thank you for sharing your expertise in the area of naturopathic medicine. You talked about your interest in chronic diseases. Any particular area or type of chronic diseases that you have an interest in?
Right. I tend to get a lot of endocrinological diseases, gastrointestinal, cardiovascular disease. It really sort of runs the gamut of conditions that people need to monitor over a long period of time. Autoimmune diseases are certainly a big part of that group.
Autoimmune diseases is huge in our world today. These are these diseases where your immune system, your own immune system, is essentially maybe attacking your cells,
right,
and causing this disease profile. Tell us about autoimmune diseases.
If we had to lump autoimmune diseases into two groups, we'd be talking about autoimmune diseases that affect a particular organ and stay sort of isolated to one organ system, or autoimmune diseases that affect the entire body or multiple organ systems. So examples of one organ would be autoimmune thyroid diseases or celiac disease, where we more or less only have one organ that's being attacked. But then we have things like lupus and systemic mixed connective tissue disease that will affect multiple tissues and organs throughout the body.
Yeah, it's a complicated process. Essentially, again, your immune system, which is there to help you stay disease-free, all of a sudden turns on either an organ or a body system.
Correct.
And you start fighting yourself.
Right.
And the result is the inflammation and degenerative tissue and pain and restricted movement. And how do you approach that from a naturopathic kind of perspective?
From a naturopathic perspective, we have to talk about the cause of the disease. So traditional medicine is very often going to focus on symptomatic management. It is often important in cases of thyroid disease, for example, or diabetes is another great example, where we want to replace substances that are missing from the body that they can no longer make, like thyroid hormone or like insulin. In cases of systemic disease, what we're wanting to do is calm the immune system down and support it. So we're often trying to reduce the body's perception of stress, provide nutrients, provide botanicals that will assist the immune system in making better choices. Part of a holistic treatment is also removing irritants, things that are going to keep the immune system on edge. So usually wanting to reinforce healthy dietary choices, stress management, reduction of chemical exposure, things of that nature, so that we can allow the immune system to respond more appropriately.
And what kind of results do you see in your practice typically as you address all these? What you're talking about, again, is this holistic, total body, mind, spirit approach, which I think is a fascinating in medicine and options for people out there that maybe just have not had good results elsewhere. And what kind of results are you seeing?
I would say, to be fair, results are always going to depend on the person, the severity of the disease, how long they've had it. So certain times I need to keep people on pharmaceutical medications to have them be comfortable so that their hormone levels are normal, etc. But oftentimes lifestyle management and botanical nutritional treatments can sometimes keep people off of their medications, or at least reduce the number of medications they have to take over the long term.
Tamara, once again, as I said before, fantastic information. Thank you for joining us.
You're welcome. It's been great being here.
We've been talking about autoimmune disease with Tamara Dickson, naturopathic doctor from Clarity Natural Medicine, clarityseattle.com to get more information. And is this something that you guys are treating at your clinic as well?
Oh, we might see some results of autoimmune diseases, tightness, restriction of tissue, joints, etc., but not necessarily treating it.
Back with our final segment as we continue after this time out on Como.